Hello, everybody. Welcome back to the Patient First podcast. I'm your host, Dr. Bryan Laskin, where, of course, we're talking about bridging the great disconnect between dental patients and dental providers so that you can grow the practice of your dreams. And I'm excited to have on a great guest today. It's Caitlin Parsons, who is a certified yoga therapist, registered dental hygienist, chronic pain survivor, and founder and CEO of Caitlin Parsons Yoga Therapy, a yoga therapy and wellness company, which is, I think, not talked enough about in dentistry because we're all hunched over working on people, which I'm sure I'm excited to hear about your journey as we talk about workplace pain, posture, ergonomics, and stress management. Thank you so much for being on the podcast, Caitlin.
Yeah, I'm excited to be here and have a conversation.
Yeah, well, I mean, you have had a relatively unique transition from dental hygienists, when we probably have a lot of hygienists and dentists listening today, to kind of your stress management, yoga therapy. Could you talk a little bit about why you decided to take that journey?
Well, I became a dental hygienist right out of high school and started working full time. And it's something that I always thought I would do. I always thought I'd be a dental hygienist for a really long time. And I want to say not even a year into practicing as a dental hygienist, I had neck and shoulder pain. I had low back pain. I was working like 6 days a week, not really taking care of myself, and got into like the downward slope of like, is this going to be my life? And I think a lot of dental professionals in general get to that point that they're like, I'm tired every day. I am achy. I don't feel good. And I kind of got to, I'd say, like rock bottom, and was like, do I need surgery? What's going on? And I walked into my first yoga class ever. It was a hot yoga class, which I never take anymore, but I started to feel just a little bit better in my body. And then mentally kind of just had this realization that my journey is actually to heal my own pain, to get out of pain, to start learning how to take care of myself. I was 22, 23 at the time, and to help other dental professionals do the same. Because it's funny, I was in an office of 20 people when I first got out of dental hygiene school, and no one was talking about how their body felt. No one was, I thought I was literally alone until I started bringing up the conversation, and everyone was like, oh yeah, my shoulder hurts. I have carpal tunnel. And I realized that so many people struggle with this in the dental field. So fast forward 10 years later, I started working with more dental professionals, became a certified yoga therapist, and really just became passionate about healing my own pain and helping other people heal their pain. And so July of last year, I quit dental hygiene for good and officially went into my business full time.
Wow. Well, congratulations. I know it's a not talked enough about in dentistry, I think. I remember there was a time when I was out of dental school, maybe 2 years, and I was doing a CAD CAM presentation for about 30 dentists in one operatory. We're all packed in there. And if I do say so myself, this onlay turned out beautiful. Like, I was so proud of like how everything went down. And then this was for a group of like very, it was the occlusion study club. So they're very like high end, very knowledgeable dentists. And so I was kind of impressed with myself. And then one of the dentists pulled me aside and says, Bryan, you have to work on your ergonomics. You are like upside down monkey hanging from a tree, right? And I remember thinking at the time, like, oh yeah, go, old man, as it gets and here I am now. Like I would be that guy because I have the aches and pains from 20 years of doing dentistry. And I do hot. In fact, I just did hot yoga a couple of days ago, and I'm trying to probably correct issues that had I listened back then and started yoga 20 years ago that I would not be having today. So it's really, I think what you're doing is great. Do you see the reception among the dental profession as being like, well, boy, yes, this is something that's needed and people are having pain and getting good results?
Yes. I mean, it's a mixed bag, like with anything, I'd say. There's definitely a lot of people that are really receptive to it. A lot of people that are already, well, there's a huge scale of some people are already taking care of themselves. They're into yoga. They're into taking like just wellness in general. And then of course there are people on the other side that's like, no, I'll be fine. It's okay. I feel okay. Or I have a lot of people that will, often say, I'm just going to be in pain. It's just the nature of what I do, or I have a bad back. But for the most part, a lot of people are really receptive. And a lot of people are really craving not just yoga to go to a yoga class, but something specific for dental professionals, someone that knows the aches and pains, regardless of, even if we had great alignment during our workday, sitting for a long time, looking down, that's just tough on our bodies, never mind the mental strain, the emotional baggage that comes with it as well. It definitely wears and tears on the body.
Yeah, and you were talking about, as we were talking a little bit before, when I was getting into wellness myself, because frankly, I was ignoring what was going on in my body for 15 years, and just like, which you can do. I mean, you can ignore a lot of pain, which I did not realize, which just leads you to having more pain, right? The pain's trying to tell you something. But for me, I had to literally like decide, why would I actually care? Because it's not really bothering me. And you hit on it before, when we were talking, that like for me, it really is about getting the results, that avoiding the negative results of being in pain, which is really affecting my clinical performance, and of my career performance. Basically, you can't perform at your best when you're in pain or having issues, right? So could you talk a little bit about kind of your experience that you've seen regarding how wellness isn't just about yourself, it's about your performance, right?
Yeah, exactly. I saw this for myself firsthand from when I was in pain and working a ton and stressed out. I literally barely, I mean, the amount to have like a in-depth conversation for 8 hours a day and educate patients properly and in a way that still inspires them, that's exhausting on the body. So if you don't feel good on top of that, it drains your energy. It puts people at pretty much empty. So I started to notice, the more that I took care of my physical body more and more, and the more that I started to meditate, the more that I started to incorporate these practices when I was in the operatory, the better I felt, the better conversations that I'd get, the better production I'd have, the better communication I'd have with my patients, but the more inspiring I could be to my patients, but to my team too. And when I'm, as a hygienist, was more connected with my team and supporting my team, it's palpable, the energy increases. So I am a firm believer in, when we take care of ourselves, we just have more to give. We have more energy, we have more focus, and our body is just not on empty. So if you think about how many people are on your team, and if everyone's close to empty and in the red zone, how the communication, how the patient experience is compared to when people are more full and feeling good and connecting and like collaborating with each other, it's a completely different experience for the patient.
Yeah, I completely agree. And there's that old Jim Rohn saying, you take care of yourself for me and I'll take care of myself for you. Right.
Yeah.
And I know that there's probably a lot of dentists or hygienists or dental professionals that are listening that are thinking meditation, yoga is not for me. Right. But I definitely resonate with both meditation and yoga as being great wellness practices. But I do think that people can get to the same type of wellness that would, like, for some people, meditation is going for a long bike ride or whatever. But I also think that for me, I thought that it was not for me until I started doing it. And then I was like, oh my gosh, this is not woo woo for me. This is exactly the right pathway to wellness. And my guess is that you run across dental professionals that happens to quite a bit. Is that correct?
Yeah, that I'm like the staple. It's funny, people see me now and they're like, oh, of course you're a yogi, like you look like one, that of course makes sense, you've always been one. I'm like, no, I'm like I was saying to you before, I'm from Boston. I'm like go type A. For me to get, I was literally tight. I was the one that said that I can't do yoga because I'm too tight or I'm not flexible enough and I don't want to wear those clothes. And I see that all the time and I hear it. And there's so many, yoga and meditation can really be, I don't know, a lot more tangible and relatable than we all think. It doesn't have to, you can break it down and it doesn't have to be the fluff and the woo. And it's really just a matter of feeling better and being more clear and centered in your mind and in your body. And like you said, it doesn't have to be that you sit down for 30 minutes a day and put your hands in a weird position and cross your legs and meditate. You can do it when you're lying down. You can do it in bed. You can do it on a walk. You can be in nature or going on a bike ride. But that's the meditation piece. And then with with actual yoga and movement, I mean, we all need to be, not we all need to, most of us can benefit from stretching different areas that if you're just sitting in general, even with the best posture, our body needs in order to function properly. So it doesn't have to be all the fluff and the woo that we see. And it definitely doesn't have to be all the fancy poses that we see these days.
Yeah, well, and you have tailored your wellness practice kind of specifically to dental professionals, right? So can you talk a little bit how, like, what are the needs for most of the, because obviously we're all working with in weird positions, oftentimes close to people that where we're seated. What are the results that you see from the typical ergonomics or lack thereof in dentistry, and what that leads to, and then what specifically, like, how do people unwind that watch?
I'm like, how do we put this simply? There's a bunch of different things. If you think about just like how we're normally supposed to stand throughout the day, and then if you had the best posture as a dental professional, the difference there, typically most of us will be really tight throughout the chest, will be weaker in the muscles of the back. There's typically some sort of head strain, whether you're looking down or just the amount of strain it takes to hold your head over your body. If you think about anyone with a handpiece or holding anything, the tighter your hands are for a certain amount of time, never mind all day, 5 days a week, these muscles are just going to get tight. Any muscles that get tight and are not stretched, and we're not properly strengthening the other muscles around it, to put simply, they're going to become weaker. So you see carpal tunnel, tennis elbow, shoulder stuff going on. Even if you had proper alignment, if your shoulders are just a little bit forward or a little bit up for part of the day, or a patient here and there, that adds undue pressure to different areas of the body. So neck and shoulder is a huge one, hand and wrist, low back, because a lot of people will just kind of like sink into their seat rather than like lifting and creating space between the vertebrae and the muscles, or the spine. See a lot of hip stuff, the leaning to one side or twisting to one side for part of the day. And then oddly enough, there's a lot of like knee and foot stuff going on. I mean, a big part of that is just sitting for most of the day. All the blood and lymph is moving down there instead of, circulating properly. And then a lot of us just have weird positions with our feet and our body. So that's just kind of a baseline. Never mind if your elbow's out to the side for part of the day, if you're doing like the weird lean, which I'm like it's funny that I do what I do, because I came from, I don't know how many times my parents a day would say, Caitlin, put your shoulders back, because I was always really tall. So I came from poor posture. I had a bad car accident, and I was the one as a dental hygienist, even though I knew what proper ergonomics was, it was like, but I just want to treat this patient. I just want to get them out. I know I can do it. And I'd hunch myself like a monkey hanging from a tree, like you said. So yeah, I could go on about this all day, clearly.
Yeah, it's a really hard profession it's easy to say having good ergonomics, but when you're working on an anxious patient that's flopping around and you're trying to do your best for the patient under those circumstances, having the correct posture, I don't even know. There's some people that can do it, but that's like the same people that the 5% of people that can do everything else with excellence, right? And even then, there's stuff that you do outside of dentistry that you're going to benefit from. And speaking from somebody, I have a severed nerve in my right shoulder, so I have no lateral rotation in my right shoulder. So for me, I have had every single issue you've discussed and more. Just getting over about a year ago, I tore my rotator cuff in my left shoulder. And when I was talking to the medical professional about it, they were just like, yeah, it's from doing dentistry for 20 years. It wasn't like I thought that your rotator cuff you had to have an incident that just like caused, no, just over time, sitting like a beanbag chair. It just snapped, and then took a good 14 months to get better. So it's vitally important. And it's not just, I think to your point before, it's not really just about your own wellness, which should be enough, but it's about being able to do your best for your patients, being able to be the best team member when you show up. And I think importantly, like we have a massage chair in my office and had yoga practices and stuff. I think if you practice wellness as a team and having accountability like that, it can be a powerful tool.
Yeah, and really a tool to bring the team together as well. I actually recently created a program for dental offices because I feel so passionate. It's one thing for individuals in the dental profession to practice wellness in whatever form, but when everyone comes together, again, it's building that connection piece and you're learning tools that you can all use together and support each other through the hard days, because that's just inevitable.
Absolutely. And I know you have on your website some free resources for dental professionals to look at. So where can they go to find out more and to get those resources?
Yeah, so my website is just my name. It's CaitlinParsons.com. And then if you were to, it's /dental/professionals. But there's a tab right there that says dental. And I have free resources for teams and then free resources for just dental professionals. So go grab them.
Thank you. Yeah. So you can find out that, well, of course, we'll have a link, thepatientfirstpodcast.com. It's CaitlinParsons.com.
Yep.
Yes. And of course, like I said, we'll put the link at thepatientfirstpodcast.com. Caitlin, thank you so much for being on the podcast. Appreciate it.
Yes. Thank you for having me.